If you clicked on this video, you're either approaching 65 and getting ready to go on Medicare, or you're helping someone that's making the Medicare decision. And Medicare can be very confusing. And so what I'm going to do in this video is I'm going to break down the essentials of Medicare to simplify it so you can make the right Medicare decisions. So the first essential that we must understand is Medicare eligibility. Now, we're eligible for Medicare by paying into the Medicare tax system. Right now, if you're working for someone, 1.45% of every dollar you're making is going into Medicare, and then your employer matches that. All right, so through FICA taxes, self-employment taxes, we are all funding Medicare. And so we're eligible to draw Medicare at a certain age as long as we have paid into this tax system for at least 40 quarters. Which is basically saying you have to work for at least 10 years to be able to be eligible for Medicare benefits. Now, most people have their own 40 quarters, meaning they've worked long enough and paid into the tax system long enough to draw benefits off of their work record. Now, occasionally people don't have their own 40, and so they have to draw from someone else's work record, which is possible, but there's some very specific rules. So if I don't have my own 40 quarters and I'm presently married, as long as our marriage has lasted for at least 1 year and that spouse you're going to draw from is at least 62 years old, they've got to be eligible for Social Security. Don't have to be taken, they just have to be eligible. So you don't have your own 40 quarters, the marriage has lasted at least a year, they're at least 62 years old, then you can draw your Medicare eligibility from their work record. Now, there are times when people divorce and then they try to get benefits from an ex-spouse. So again, don't have my own 40, I'm not presently married, and so you actually can draw from an ex-spouse as long as that marriage to them lasted at least 10 years and there was no remarriage prior to the age of 60. So if you remarry prior to the age of 60, you cannot go back to the ex-spouse unless that second marriage it would end in death or divorce. Then you can go back to that ex-spouse, all right? Meaning you have to be single or have had a divorce after that remarriage. You can draw from that ex-spouse, again, as long as the marriage had lasted at least 10 years. All right, now there are times when people are married and then their spouse dies. So here's the way that works. Again, I don't have my own 40 quarters. I want to try to get someone else's work record, and that person is now deceased. So if we were married and then they passed away, as long as their marriage lasted at least 9 months, that's all it had to last, and there was no remarriage prior to the age of 60, you can draw from that deceased spouse. Now, let's suppose you were married and then divorced and then they died. You can still actually go back to that deceased ex-spouse as long, again, as the marriage lasted for at least 10 years, no remarriage prior to the age of 60, unless that second or third marriage ends in divorce or death, then you can, of course, go back. All right, so the point is we're always looking for 40 quarters. Either that's our own work record or someone else's work record. Now, the majority of people actually start Medicare eligibility at 65. It's their 65th birth month in which they're eligible. Unless you're born on the first day of the month, then it's always the previous month. So my birthday is January 3rd, 1961. So my first month of eligibility is going to be January then of 2026. I would be eligible actually for Medicare. So that's at 65 as long as, again, we have 40 quarters. Now, there are some people, actually about 15% of the Medicare population, that is below age 65, and the reason for that is because they came through Medicare because they were diagnosed with some kind of an emotional or a physical disability, therefore qualifying for Social Security disability. And as long as they have been receiving these disability checks, what happens on the 25th month of having received Social Security disability, their Medicare A and B will go effective regardless of age. Anyone with Lou Gehrig's disease or permanent kidney failure, end-stage renal disease, then they, again, can get Medicare below the age of 65. Okay, so most people at 65, the other would be because of disability or those two health reasons. All right, so that's how we become eligible for Medicare. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. All right, so the second essential then is Medicare enrollment. Now, there's actually 2 different ways in which we can enroll into Medicare. One is actually auto-enrolled. Auto-enrolled means that you are taking Social Security benefits. That could be retirement benefits, it could be survivor benefits, it could be spousal benefits. And when we're taking those forms of Social Security, then we're automatically enrolled at 65. And what happens is the Medicare card is actually mailed to you about 100 days in advance of your 65th birth month. All right? And so you'll automatically get the card. It's going to show up in the mail. Now, those who are not on Social Security are not going to be automatically enrolled, and those group of people are going to have to be self-enrollers. All right, so nothing will happen automatically whatsoever, so I'm not receiving Social Security yet. I'm going to start my Medicare at 65 or whatever age, and then I'm going to have to initiate that enrollment myself. Okay, now there's a couple different time frames for enrolling into Medicare. Now, anyone that's going to start their Medicare at 65, whether they self-enroll or they're auto-enrolled, that particular enrollment period we call the initial enrollment period. And again, this is for anyone starting Medicare at 65. And so if I'm self-enrolled because I'm on Social Security, this is the enrollment period that the government used on my behalf. If I have to self-enroll and I have to start at 65, then I'm going to do it during this initial enrollment period, which lasts 7 months, and that's it. So for people that have to start Medicare at 65, and by the way, there's actually 5 groups of people that have to start Medicare at 65. You have no option, okay? And that would be this. Anyone that they or themselves or their spouse is covered by a retirement insurance. You have to go on Medicare at 65. If you're covered by COBRA insurance, you or your spouse's COBRA insurance, you have to go on Medicare at 65. If you're covered by an Affordable Care Act, a healthcare exchange marketplace plan, you're going to go on Medicare at 65. If you're a TRICARE, which means you're retired military, you're going to go on Medicare at 65. You have to. And in all those situations, we're going on Medicare because Medicare is going to be the first payer. Now, another group of people that has to go on Medicare at 65 would be people that are still working, they or their spouse still working, covered by an employer-provided health insurance plan, but that employer is a small employer, which means there's 19 employees on the payroll or less. Okay, that group, 19 or less employees, you have to go on Medicare at 65. So again, anyone covered by retirement plan, ACA plan, a COBRA insurance, TRICARE for life, government insurance, retired military, and 19 or less employees in the company plan, you're going to have to enroll into Medicare. Now, if you're in a group of 20 or more, you don't have to go on Medicare. You don't have to take A, you don't have to take B. Now, some people will hear they have to take A and you don't. If Medicare A is free for you and you're still working, your spouse is still working, covered by an employer-provided plan, and there's 20 employees or more, you don't have to do anything at all with Medicare. Now, if you choose to take Medicare A only, that's fine. You don't have to enroll into it to avoid a penalty because if it's free, it's always free. Just remember, if you do take A only while you're still working, you can no longer contribute to your health savings account, an HSA. That's not flexible spending, that's not health reimbursement arrangements, just HSAs, any form of Medicare enrollment, you can no longer put money into that. And so here's my point. If we have to go on Medicare at 65 and we're not on Social Security, we're going to have to self-enroll. We have 7 months to do it. So let's say that my birthday is 7/15/1958. Okay, that means I'm eligible for Medicare 7/1/2023. That's my eligibility at 65. It's always the birth month. Now remember, if you're born on the first day, you move it up one previous month. So we have 7 months. That's 3 months before my birth month, the month I turned 65, and then 3 months after. And so in this example here, what's happening, if I enroll into Medicare April, May, or June, my Medicare will start July 1. But if I enroll in July, what's going to happen is they're going to put me off for a month. And so I'll start in August. If I enroll during the month of August, they'll start me September. Enroll in September, they'll start me in October. And then the very last month I can enroll of the 7 months would be October, and they will start me in November. So obviously my coverage is being delayed a month. All right, so this is for those that have to start at 65. If you self-enroll, you have the 7-month window, and that is it. Okay, now the question is everyone going to start Medicare at 65? And the answer is no. If you or your spouse are still working, you're covered by an employer-provided plan that is 20 employees or more in that group, then you do not have to start Medicare. So if we do not start Medicare at 65, and let's say we want to start 2 years later, that is fine. And that enrollment period, though, is different. The IEP was for those starting at 65. The SEP, which stands for a special enrollment period, is for those that are starting after age 65. So let's just say we're going to start Medicare at age 67. Again, let's go back and say that my birthday is 7/15/1958. I was eligible for Medicare 7/1/2023, but I'm covered by a group plan that I like. Let's say I have a health savings account, I'm contributing to that, and so I don't want to do anything at all with Medicare. No problem. And we're going to start 2 years later. So now we roll the clock forward and say we would like to start our Medicare 7/1/2025. All right? So what we have to do is we have to go back and we have to verify from your 65th birth month, which is 7/1/2023, 2 years back, that you have been working or your spouse is working, and we've had credible insurance, actively working, covered by a group plan with no gaps whatsoever. We got to go back to our 65th birth month and proving credible coverage. The way we prove credible coverage is with a government form called an L564. And this form, you fill out some of it. If you work with us, we would do this for you, but your employer has to actually verify employment and coverage, and they'll do it on one simple government form called an L564. In addition to the L564, we have a form called the 40B, and this is, again, a Medicare form. And what the 40B does, once we prove we're eligible for an SEP enrollment, again, all we have to do is been working, covered by a group plan, ours or our own or our spouses, proving that with the L564, then we get to pick the month we want to start our coverage. So if I want to start my Medicare 7/1/2025 on my 40B form, I would put on there, please begin my Medicare effective 7/1/2025, and that's the date they will honor it. So some people start at 65, that's called the initial enrollment period, but if you're your spouse working 20 or more in the group, you don't have to. You can come in later using this special enrollment period. There's no penalties, there's no problems whatsoever. Again, as long as you had credible coverage with no gaps, back to your 65th birth month, okay? And so that's the IEP or the SEP. Remember, if you're enrolled in Social Security already, they will automatically enroll you to Medicare at 65. Now, keep this in mind. A little confusing, but it's important to know. If you are enrolled into Medicare automatically, you do have Medicare A and B. But if you or your spouse are still working, group of 20 or more, you don't have to take B, and you actually can take B at a later date. And the reason that matters is because Medicare A has a zero premium, but B has a premium. And so if you or your spouse are still working 20 or more, that's in the group, Medicare is in the second payer position, and you just paid $164.90 out of your Social Security check to put Medicare in the second payer position. So as long as, again, if we have a group plan, we don't have to take B, you don't have to pay for it, and you can pick it up when you lose the group plan. All right, so that's the way the Medicare enrollments work. All right, that brings us then to the third essential, and that has to do with Medicare expenses. Now, anytime we talk about healthcare expenses, there are a variety of them, and let me identify those real quickly. First off, we usually have, when we have health insurance, we have some type of a premium that we have to pay. And then we also have, in most plans, we have deductibles that have to be satisfied. After deductibles, we can have then copays. We can have coinsurance, which is, a percentage of the bill. And then we also have what's called MOOPs, or max out-of-pockets. So those are typically annual max out-of-pockets. So those are the 5 aspects of any kind of a healthcare plan. So as we break those down and we look at Medicare expenses, here's the way it works. As far as premiums go, Medicare A for most people is zero. As long as we have those 40 quarters or our spouse does, there's no cost for Medicare A. Now, if we have less than 40 quarters, right now, anyone that has 30 to 39 quarters, Medicare A is $278 a month. Anyone 0 to 29 quarters has to pay $506 a month for their Medicare Part A. Again, most people it's 0 because of 40 quarters, but if not, it can be purchased. Now, Part B, right now, this is 2023, I'm shooting this video, so if you're looking at it in a later year, then it could be different. But right now, the Part B premium is $164.90 a month. If someone's on Social Security, that comes right out of their check. If it's not, the government will either do a bank draft monthly or they'll do you a quarterly direct bill. But the point is we have to pay for Medicare Part B. Now, this Medicare Part B can be higher for some people, and that means if they're higher income. I'm not going to get into all the details of that, but I want to make sure you understand that this particular Part B premium is based upon what's called a modified adjusted gross income. And modified adjusted gross income on every tax return is going to be line 11 plus line 2A. So line 11 is the adjusted gross income modified by line 2A, which is your tax-exempt interest. So someone invests in municipal bonds, they typically don't pay federal taxes, maybe state but not federal, and so they take the tax-exempt interest, add it to line 11, and that becomes the modified adjusted gross income, and then that number determines how much you pay for Part B premium. Okay, so some people pay more than $164.90. So anyone that's a single filer that makes $97,000 or less pays the $164.90. If they're above the $97,000, above that, then they pay more. That additional amount is a surcharge called an IRMA, income-related monthly adjusted amount. And so we have $97,000 now for a married filing a joint return. That number is $194,000 or less. Each of you, again, would pay the $164.90. If a couple's above the $194, then again, they're going to have that surcharge. There's actually 5 levels of surcharges. And those surcharges are for the Medicare B as well as the Medicare D drug plans. And combined, those are about $80 up, depending upon someone's income. All right, and so the point is we pay a Part B premium. Most people pay $164.90. High income, you're going to pay more for that. So that's the premiums for A and B. Now, when we talk about other expenses in original Medicare, we call those gaps in your coverage. And I just want to do just a brief review on this. The A of Medicare is inpatient. The B of Medicare is outpatient, and all doctor services as well as durable medical equipment. And so on each side of these parts of Medicare, we have 3 financial gaps that would be an expense for you. You're responsible for these. And so the gaps on the A side this year is the deductible of $1,600. That means you go to the hospital, you owe $1,600. And that covers us up to a 60-day stay. That's the only out-of-pocket expense. But if I am in longer than 60 days, then I go to my second gap, and that means days 31 to days 61 to days 90. I have a $400 a day copay that I'm responsible for. These are pretty rare, but they're very expensive when they happen. Days 91 to 150, I have an $800 a day copay that I'm responsible for. These are called extended hospital stays. Very expensive. And then also covered by A would be a skilled nursing facility. After a stroke or a hip replacement, we go to rehab. Medicare says first 20 days, they cover everything, but days 21 to 100, if I'm still in skilled nursing, I would have to pay a $200 a day copay. And all I'm trying to teach you is that we have gaps, so you have to pay these copays and this deductible. On the B side of Medicare, remember everything outpatient, doctor services, durable medical equipment, home health care. We have a deductible of $226 on the B side. Now, one thing about this deductible is this one is just once a year. This deductible in the hospital can occur more than once in a year. Now, after I met my small B deductible, then Medicare pays $80 and I pay 20% of the bill. All right, that's called co-insurance. And then lastly, there are some doctors that add 15% to the bill. That's called an excess charge, and Medicare allows docs to do it, and when that happens, you have to pay for it. So here's my point. These are gaps in original Medicare, and you can see there's some deductibles, there's some co-pays, there's some co-insurance. So the majority of people that stay in original Medicare because of the benefits of being in that system, what they will do is they will buy what is called a Medigap policy. A Medigap, these are also called supplemental plans, okay? Supplemental. Now, when you buy a supplemental plan, you have to pay a separate premium for these gaps to be covered. Most people today are getting a G plan. A G plan. That G plan for most places on average is about $125 a month. Okay, $125 a month. But what that G plan does is it covers all the gaps here except this one. So out of pocket, you meet one gap. So that G plan covers 5 of the 6 gaps. Now, some people are getting an N plan. It's also a good plan, covers 4 of the 6 gaps. So if you had an N plan, it would cause you to also pay the 15% excess. So again, G covered everything but the B deductible. N covers everything except for the B deductible and excess charges whenever it occurs. And we've got a couple co-payments to see a doctor, go to the emergency room if we take an N plan as well. But my point is this, we pay a premium for that. That N plan would be about $90 to $100 $5 a month. So a little bit lower premium, but you're taking on a little bit more risk. And so as we look at these expenses, we have the right to take those expenses and to transfer the liability of these gaps to a Medigap company. You pay them a premium to take the liability away from you. All right, so you don't have much out of pocket other than your premium and a few other small items. All right, so that's one way in which someone can do their Medicare. Now, another way in which people can do their Medicare is called an Advantage plan. Advantage plan. These are also called C plans. C plans. Now, most C plans, when we talk about premium, we still have to pay our Medicare. Remember our $164.90? We got to pay that if I'm on a C plan, but then usually the insurance company doesn't charge me any premium to be on their Advantage plan. And the reason for that, instead of paying a premium like I had to on that supplemental plan, I pay zero premium because now I'm going to pay as I go. So I'm going to have possibly a deductible with that Advantage plan. Many of them don't, some do, but I'm going to have lots and lots and lots of copays for sure, and sometimes I'm going to have co-insurance. So no premium, but I will have to pay out of pocket. So I go to the specialist, may cost me $50 to see a specialist. I go to the hospital, probably going to cost me $350 a day for anywhere from 5 to 7 days every time I'm hospitalized. If I had an MRI or a CAT scan, probably cost me $200 for the scan. If I had outpatient surgery, say cataract surgery or maybe a knee replacement, probably going to cost me $300. But you see the point. So with the C plans, Advantage plans, I pay Medicare. I don't have to pay a premium because instead I pay as I go. And all my payments, though, are going towards my annual max out of pocket. Most HMOs today on Advantage are going to be anywhere from about $3,000 to $5,000 max out of pocket. Most PPOs are going to be somewhere between $5,000 to $7,000 out of pocket. Again, because with the Advantage plans, we always have these networks. And so again, as we talk about expenses, either way I go, whether I have a supplemental plan or an Advantage plan, I have to be enrolled in Medicare. If I have a supplemental plan, I paid a premium to get rid of most of the liability. If I have an Advantage plan, I didn't pay a premium, but I don't take on the liability of whatever healthcare expenses I'm going to need. Now, lastly, we're also going to have a drug plan. And so drug plans vary anywhere from about $10 a month. The average right now is about $25, $30 a month. Some are as high as $70. But for my prescriptions that I self-administered, I have to have a separate drug plan and a separate premium. Now, if I choose to get a C plan, they also will include a drug plan at zero premium. So then all I have to do is pay copays for my medications. All right. And so this would include most of the expenses that you're going to incur whenever you go on Medicare. It's got to be an A and B. A is free, B has a premium. And then if you get a supplemental plan, you have a premium, get rid of the other risk. If I have an Advantage plan, I pay my B premium at $164.90, but then I just pay as I go until I hit my max out of pocket. And these max out of pockets then reset every January. I pay as I go, and then once I hit the max, if I ever do, then there's no additional out of pocket. That plan will pay 100%, and then it resets again every January. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And the final essential that I want to talk about is getting Medicare help. It is very rare that people try to get onto Medicare and make all these decisions all alone. Typically, you're going to have someone to assist them in the process. Now, you can certainly call Social Security or Medicare and get some generic help. Medicare.gov is a website that will give you some information. But really, as far as navigating the whole system to really understand all your options and doing this properly, most people are going to reach out to an agent to get the help. And there's two types of agents. There are what we call captive agents, and then there are brokers. Okay, now we have chosen to be brokers simply because a captive agent doesn't make this bad, by the way. It just means they write for one insurance company only. And that's it. That means you don't have a lot of options with a captive agent. They work for that one company. Brokers are going to work for multiple insurance companies. And we've just chosen this because we know one size doesn't fit all. People like to be sure they have all their options. And so within brokers, what you're going to find is you're going to find some that want to push what they call Medicare Advantage plans only. Okay, and that's all they want to talk about. And they talk about some of the perks and the cheap premiums and all that, but they want to talk about Medicare Advantage only. And I'm going to tell you why. Because brokers that just talk about these are doing so because this is where we make the most money. The highest commissions in Medicare today are paid on Medicare Advantage plans. Again, that doesn't mean that someone doesn't care about you, but if that's all they talk about, primarily they care about their commission. And so the second way in which you can use your Medicare, and I just talked about it, would be called a Medicare supplemental plan. And I just believe that an agent is ethical and honest and really cares about people if they talk about both, because they're two different systems and they're totally different. And so we believe that we have to tell you about both of them because one sometimes is better than the other for you. And so the whole point is this, a broker should tell you about both of these plans. Supplemental plans are really, in my opinion, premium insurance. You got to pay a little extra for that, but it's a wonderful, wonderful system because you can go to any doctor who takes Medicare and you never have an insurance company that can deny the coverage. If Medicare says they cover it, doctor says you need it, in the story. Medicare Advantage plans, not so. You always have pre-authorizations and pay-as-you-go system. So the point is, these are two different ways. So if you work with an agent that only wants to talk about this, I don't think they're going to be someone that really is being ethical because this too is a viable option. And you need to be able to look at all those. And then of course a price comparison, making sure you understand the importance of the initial premium, but also stability of the rates. And then really any agent you're working with, they ought to care enough to make sure that you also get right on the right Part D plan, because that's going to be a very important component of your coverage. Either that Part D plan is embedded here or it's going to be a separate plan here. But either way, we spend a lot of money on medications when you get sick, and so you want to make sure that you have the right drug plan. But whoever you use, I promise you, the price is always the same. The insurance companies set the premiums, the agents do not, so that's always the same. And there's going to be no cost here, and there's no cost here whatsoever. Why? Because the insurance company always pays the agent. All right, so there's no cost whatsoever for your assistance. But again, I think if you use a broker, you're going to find typically more knowledge, definitely more options, and if they're honest, they'll tell you about all the plan options available to you, not just one. All right, so those are the essentials that you misunderstand to make a good Medicare decision.